And for colleagues that don't know me, I'm Gillian Bishop. I'm Chief Executive at Northwest Employers, and it's my honour to be chairing the session today alongside some great colleagues who will be supporting me as we go along the next couple of hours. Great, as I say, to have colleagues joining us from across the whole of the Northwest. Absolutely fantastic. For this masterclass, which is obviously focused on political leadership and learning how democratic and participatory approaches make a difference across public services. I am sure we are well, very kind of well educated in managing Microsoft Teams or Zoom, which is what we're using today. But I will ask my colleague Effie just to pop on the screen a slide around kind of Zoom etiquette so that we can make sure we maximise our online session today. Thanks, Effie.
Hello, everyone. I'm sure you're very familiar with all of this, but just a quick update. You can change your participant name to show your name and surname by clicking on participants on your toolbar. You can select yourselves and then click on rename. If you have any questions, please feel free to share them in the chat box. We might not be able to answer them there and then, but there will be Q&As throughout the masterclass today, and that will be a good opportunity. You can mute or unmute yourselves by clicking on the microphone button. Similarly, you can share your camera or not by clicking on the camera button. You can put your hand up by clicking on participants, and then you can click on reactions. You can see who else is in the session with us today. And yeah, that's about it. It's pretty self-explanatory by now. I'm going to pass you back on to Gillian.
Wonderful. Thanks, Effie. As we say, this is our world now, isn't it? Who would have thought that we would be in this situation? But it's great for engagement and certainly to bring colleagues together from across the region. If you do have any problems or issues with your connection or with Zoom, pop kind of a question in the chat and we will do our very best to help you through it. So we've got on screen now the programme for the day, which is super. And as colleagues will know, if you have attended a masterclass before, we bring you the masterclass programme as in collaboration with 6 partners that are working together to deliver the masterclass series. As I say, my organisation is very proud to be part of the collaborative Northwest Employers, and we work with and alongside colleagues in AQUA, Advancing Quality Alliance, the NHS Northwest Leadership Academy, the Innovation Agency Northwest, Northwest ADAS, and Merseyside internal audit. So it's great that we're able to have a cross section of colleagues from across the public sector, and again lots of skills, knowledge and expertise across those 6 partner agencies to bring hopefully what you find is a very interesting and innovative programme of masterclasses. So today our focus is political leadership. I will introduce our key speakers in a moment or two. But what we want to make sure today is about is some input, and we've got some fantastic input from colleagues with experience in terms of their political journey and political stories that they will share. But we do really want this to be an interactive session. We know we've got some elected members on the line, some colleagues from NHS, some colleagues from local government. So again, a really good cross section of colleagues to stimulate discussion and debate. We are recording the session, as you know, so if you do want to share it with others, we circulate the recording and slides after the session, so please do feel free to share them widely. And also, if you are tweeting this morning, please do raise the profile of our event on Twitter. Our handle is #CollaborativeNorthwest. So please do feel free to get our message out there and to get the conversation going in Twitter space. In terms of comfort break, you'll see on the programme we haven't got a planned comfort break. We will continue through to 12 o'clock, but please do, if you do need to have a drink or a comfort break, please do pop out and pop back in. We will still be here and going through. So that is the plan, an exciting plan for the next couple of hours. As I say, we want to make it as interactive as possible. Please do use the chat box. Thanks for everybody who has started to use it already. And I would like to invite you to kind of share any comments, questions that you have as my colleagues are presenting. And what we will do is pull out some key themes, some key questions, so that once we've had input from Maureen and Joanne, we can then have a really good conversation around kind of key issues and to answer any questions that you're popping in. And my colleagues, Kath and Pam, will be on hand to collate a number of those key questions and key themes for this session at 10 o'clock. So I think without further ado, we are now able to move into our key speakers, and it's my absolute pleasure to welcome Councillor Maureen Bateson, MBE. Maureen and I have had the pleasure of working together on the Portfolio Holders Network for Children's Services. And you would not know looking at her, but she has actually got 39 years experience of working in the political sphere. So we're going to ask Maureen to try and cram her 39 years of fantastic experience into 15 minutes. So on that note, Maureen, welcome. It's a delight to have you with us this morning, and over to you. Thank you.
Thank you. Good morning. Can everybody see me?
We can see you and hear you, Maureen.
Very good.
Thank you. Loud and clear. Good
morning. So I'm currently Assistant Exec Member for Children Education in Blackburn with Darwen. I'm assistant because I'm on my way out. 39 years has been enough. So it's nice to be with you all, and I'm going to tell you a little bit about myself and about my life, because that's influenced what I've done in my political life. I grew up in a rented terraced house. We had, outside toilet, no bathroom, all that sort of thing. My family were great, but I was late in my parents' life, and it did lead to some health problems for me. I passed my 11 plus, got a job when I left school, fine. And at 17, I was diagnosed with TB. So I spent quite a bit of time in hospital, and that's left me with some long-term serious problems. Life was going okay for me, and then I started a relationship, always a disastrous thing to do. I left home. I had 2 girls, but unfortunately that relationship was abusive, and I finished up living in a refuge. I came out and got a council house on a fairly notorious estate, but the people on there were really great, and I learned a lot from them over the years. I had to live on benefits. I did marry some time later, and I had another son, and it was fine for quite a long time. I am divorced now, and after about 15 years. I then, not long after I got divorced, was diagnosed with cancer, but I managed to overcome all those troubles. I brought up my family. I worked part-time while the kids were at school, and then I worked full-time as well as being a counsellor. I've always been interested in politics ever since I've been at school. The MP for Blackburn at that time was Barbara Castle, so she's my inspiration, you could say, and I'm pleased to say I've met Barbara a few times, and next month I'm going to unveil a statue to her, so that's great. I was also interested in American politics because it was at the time of the Kennedy assassinations and all that. I joined the Labour Party in 1979, and I was elected to council in 1983. I've held many positions in the council. I've been mayor, I've been chair of the local Labour Party, I've been deputy leader. When I first got onto council, we then ran a committee system where everything was run through committees, decisions were made at council, long, laborious meetings, I have to say. However, I would say they were very good learning exercises, and I think it was good for members and it was good for officers to learn that way. And it was very, how can I say, they were very challenging meetings. My first role was vice chair of allotment, so you could say I started at the grassroots. I then progressed on to become chair of housing because I once threatened to evict all the allotment holders. So I think they thought that chair of housing would be quite a good job for me. Because I'd lived on a council estate and done all that, I found that the council told people what they were going to have, how they would live their lives and everything like that. So I started to introduce things like tenant choice, estate management boards, decentralised offices. We took the service out to people. It was resisted, let me tell you. I've seen lots of, have had lots of arguments with some officers, but I knew it's what people wanted because I went out, I organised tenants groups, we talked to people, and I had some angry meetings with residents, believe me, but it was important that they got a chance to air their views about how their lives were. We looked at setting up a young people's homeless group, various other things, different groups. We also had a large housing clearance programme in the private sector, and having to tell people that you're going to clear the house is a very, very difficult thing. And so it has to be done with some reasonable element of understanding why you were doing it and to get it through past your political parties why you needed to do it. I also had to oversee the transfer of our housing stock to a social landlord. That was done by a tenant's vote. Whether or not I agreed with it is another matter. We also at that time did our own housing benefit. And I felt it was a very sympathetic system that we ran. I'm going to tell you about an incident where one day a gentleman came into our offices who hadn't received his housing benefit. He was very abusive and he was asked to leave. And he did leave, but with threats that he was coming back. He did come back. Our senior officer went out to see him. He threw liquid at him, set it alight, and that officer subsequently died from his burns. That gentleman then went home to a multi-storey block of flats and threw himself off that block of flats and killed himself. His housing benefit cheque arrived that afternoon, and it was a traumatic time for everyone, including staff, including the families, including everyone involved. And we had lots of trade union difficulties. People were in fear. They wanted screens putting up. They wanted all sorts. So we had to use a lot of persuasion, talking to staff and doing things to make sure that people felt that we weren't cutting everybody off, but we made staff feel safe. From housing, I then moved to finance and I got the benefit system. So I opened up our town hall, new customer services for benefits, new budget systems. I decentralised all budgets to ensure that staff understood that the money that they were spending they had a purpose to how they were spending it, and they had limits on what it were. In 1997 was the start of our unitary authority, and this became a different sort of system, and we went into the system that we have currently, the current cabinet system. where we have a small number of members who have portfolios for different areas of the council. Decisions are made by a cabinet and are subject to a calling procedure, but they're also subject to scrutiny. So we have our backbenchers who sit on a scrutiny committee. I think from the committee system, which I went through, and this, there is a limited scope for challenge and change if the decisions being made by that executive member and the director. There is some scope for change, and there's some scope for persuasion, but it is limited in some respects. Getting it through the labour groups, the more difficult one than the scrutiny committee. My first portfolio that I took on was benefits, surprisingly enough, and I renamed it to call it Rights, Advice and Entitlements, because I hated the word benefits. And we set up an advice centre, which used to open on a Saturday morning, and I was often found in there on a Saturday morning because they made good tea and coffee. So, but I helped lots of people, and you listen to the stories. And it was really interesting to see well, it wasn't interesting, it was depressing to see the desperation on people's faces and how they were getting on. I then moved to social services. My political life really has always been about people, and it's where I felt I could do most good. I feel I've always had a hands-on approach. I've gone round offices, I've gone out to decentralised offices, I've talked to staff, I've talked to different groups of carers and children and older people, set up an older people's forum, a domestic abuse forum, you name it, I could set it up. And I found that listening to people and what they thought about services and how you could change them was a good way of making policy. Even, and I didn't say it, but before we became a unitary, I was mayor. I thought I'd just throw that in because I had nothing to do that year. And I spent my year actually campaigning for a zero tolerance about abuse, because I thought, as mayor, you've got a chance to make not a name for yourself, but bring forward a subject. So I thought it was, I also had a campaign while I was at social services around people with disabilities, because I did think, and so we set up respite centres for both children and for adults. We wanted more day centres, and we looked at how we could look at better housing, supported housing for people. When the services split, I went with the children's service, and that joined with education. If children's services, if things go wrong, you are legally responsible. You are held to account, along with the chief executive and the leader. I thought that was like a fallback. I always blame them. We're also subject to Ofsted and lots of other inspections. And in fact, it's the most inspected service within the council. And if we're found to be inadequate, the government will put in inspectors, and it will be a major financial cost and reputation cost to the council. As I said, some of our initiatives included a respite centre for children with disabilities, a special hub for them. We introduced standalone children's centres, work with parents, with young people, foster carers. I wanted to give them a voice, and especially for children in care, to make sure that they had a voice. We introduced a front door, and I think a front door and a one port of call is really important for every service, that you don't have to go through lots and lots of people. You have one phone number, one front door, and it has to be the right front door. I've always found if you're in the wrong front door, you're in trouble. I think one of our biggest challenges while I was doing children's and adult social services was dealing with sexual exploitation and grooming by gangs of predominantly Asian men at that time. Blackburn is a multicultural area. It came to my attention quite early on what was likely to be happening, where it was happening, and the implications. I went through some very traumatic times with some of those young girls and listened to their stories. I wondered what to do, how best to challenge it. And I brought in the press. I opened it up to debate. The press, along with the council, ran a campaign against what was happening. We set up a multi-agency hub. We brought different services together because at that time we were having great difficulty with the police, who were treating these girls as the problem rather than they were the victims. So we brought people together. I can tell you it caused a lot of racial tension in the area. I was subject to a number of difficult conversations. And I felt that people who should know better didn't know better and should have opened up a lot more, and we did. Did we help the situation? Yes, we did. Did we resolve it? No. Is it still there? Probably. And it still does happen, but not certainly to the degree. But what we do have is a system to deal with it. And that's the important thing. To identify issues for me, for children and families, there has to be a good referral system. And I've said before, it's to be one point of access for a team then of different agencies coming together to look at the different issues faced by children and families. I don't know whether or not there is really one issue when you're dealing with a family and a child that can be identified. And at that time, there were, you can look at, is there alcohol, mental health issues, is there domestic abuse in the house, whatever it is, you've got to have a team of experts or people who understand it. No one person can deal with all those, and that's why it's important. I think one of the other major things that politicians have to deal with, well, I suppose any organisation, are cuts. Some people call it looking at better how you use your finances. I call it cuts, call it what it is. And I think it's important that what you do is, rather than just cut a service, look at how it can be done differently. Does it have to be the council that does it? Does it have to be the organisation that does it? Can it be somebody else? A recent decision that I took was around cuts to youth clubs on our young people's services. I was determined I wouldn't cut youth clubs, but we couldn't afford them. So I found somebody who could maybe help run our youth clubs and also input some of their own money. So I went to Blackburn Rovers Community Trust, who I'm a trustee of, and convinced them that they'd be a good partner. And we worked with our youth zone, and we've brought other partners on board. So we now have a youth alliance, all working together across the borough, delivering the services. And we as a council and our youth service, young people services, support those. So when they're having difficulties, and we still do the targeted youth support where there are young people with difficulties. I think the latest challenges have been working with health. I've sat on boards for many years, health and wellbeing, children's partnership boards, children's safeguarding boards. Legislation now in children's services means that not only the council has a safeguarding role, but so do the police and so do health. It's shared equally. So where children are being safeguarded, health and the police have as much a role as we do as a council. And that's why partnership works. However, there are difficulties because IT systems don't talk to each other, data protection doesn't talk to each other, people use different languages in different departments. There's always difficult and complex problems. When we brought health visitors and school nurses, when they came over to public health, we put them in our children's centres. Nobody knew how to use the different systems, how to do this and that. But over a cup of tea and a kettle, you know, put it together, we solved the problems. Because if you're determined to do something, I don't use the word can't. I know there's the word won't. I just say you will do, which is different. But tell me why you can't do it, and that has to be. And we can work through everything. I've recently as well been involved with primary care. I sit on our primary care network. That is a challenge in itself, talking to GPs. I was on one yesterday and I felt so frustrated. We were talking about the referral system. I think they think referrals are only for older people, things that they understand. GPs don't understand children and young people. They see people as families. They don't see young people as children in their own rights and young people. And we had a bit of a disagreement, let's put it this way, about how they should do that. So that's an ongoing one. But I think it's important, if you're working in any service, to know what's available in your area. That you might not know how to deal with a situation, but somebody else does. And that's the breadth of partnership working. As a councillor, I've had to answer to a lot of people over time. My family even make appointments to see me these days, but they, as an executive councillor, I was responsible to staff, to officers. You were responsible for that. I was responsible to the local party, to the national government. Well, no, I weren't. I'm never responsible to national government because they just go their own way. Importantly, the residents in my area, but most importantly, the children and young people of Blackburn with Darwen. They're my priority, and I want to make life for them as best I can. I want them to have the best education. I want them to have the best opportunities in life. And if somebody stands in my way in providing that, then I'll go to town on them. I'm usually a very placid person, but I am known to have a bit of a temper when I need to. But it's a temper that sometimes is about fighting for others, because a lot of people need an advocate. I found over time, when I first lived on the estate I was put on years and years ago, there were a great set of people, but they used to come to my house because I was the only one with a telephone. And so they used to get me to ring up and get them what they needed. And I found that a lot of people just need a voice sometimes, or just need somebody to talk to. All the big schemes in the world aren't always what people need. The very thing that people need are the small things that can make a difference to their life. And so if you're making policy, all I can say to you is think about the detail, think about who it affects, think about what you can do. Beside everything I do, I run a lunch group. I'm a part of a local community centre that runs a food hub. I'm a patron of a local charity where we provide sacks of toys for children at Christmas and lots of other things. I'm a trustee at Blackburn Rovers Community Trust.
Maureen, if that's okay.
So I've learned a lot of things over the years, and these are what I'm going to tell you. It's often the small things, which I've told you, make a difference to a person's life. Learn to recognise and understand things like poverty, neglect and abuse. And when someone needs help, more importantly, what can you do about it? Or find somebody who can. Know that much bigger and better things can be achieved by partnership working. Know your area and what's available. And if you don't know, make sure you know somebody who does. Never be fobbed off by people telling you they can't do things. Just tell them to go away and find what you can achieve. Never be afraid of change. Never be afraid of change. But make sure any changes you're making are made on behalf of the people, not of the service that you're representing. Because so often I find we've made changes to the service to make it better. No, you haven't. You've made it better for yourself. Don't ignore abuse or discrimination. And I noticed a question as to why I raised the issue earlier on about Asian groups, because that was the problem at that time, men's groups. I could come back to that, but that was why I raised that one. But sexual abuse occurs by all people. That was a problem at the time. Learn how to deal with the press. And make friends with the press sometimes, because they can be useful. I've found that. And what you can say, but you've also to be careful of social media. I use social media. I try to be very careful, but it can be used against you. Respect all the staff that you work with. Get to know them. Listen to them. Do whatever you can. Be honest with people. And if you can't do that, tell them the truth. Just always be honest. Ensure that when you show authority, you do show it. But most of all, I would say, save time for yourself and your family. Don't forget that you're a person as well. Thank you for listening.
Wow, Maureen. Thank you so very, very much. Wow. 39 years of wisdom in 20 minutes. We need to bottle that and share it far and wide. You may not have seen it, but in the chat, people are saying, wow, what an inspiration. Maureen is an inspiration. And you've got local residents in the audience as well, Maureen, which is fantastic. So Stephen's from Darwen, and he's been mentioning how brilliant you are and the work that you do. I think your passion for people and your personal story absolutely shone through, and I think the kind of the list of things that you kind of summarize with at the end are certainly a very, very well developed and well thought through list that I think we can all certainly take away and live our lives by. And at the end, as you say, actually time for yourself, time for your family, and certainly, you know, as we are all living now and the year that we've had, I think there are absolute words of wisdom. So huge thank you. We'll let you take a breather. We will come back. There are some kind of key questions and some key areas that colleagues have raised, but we'll hold those for now. As I say, we are indebted for that contribution, Maureen. Thank you so much. And we'll move over to Joanne, to Councillor Joanne Harding, who's also now going to share her story and her political journey. Joanne has been an elected member for 11 years and based in Trafford. Currently portfolio holder for adult social care, and we have had the pleasure of working with Joanne at North West Employers in a number of areas. Joanne is a key figure and leads the work that we do around women in political leadership, the network that we've set up there. She supports and leads on the Life as a Councillor programme for new councillors, and also is the chair of our portfolio holder network for adult social care across the North West. So it is my pleasure to invite Joanne to share her story with us. Thank you, Joanne, over to you.
Thanks ever so much, Gillian. I have no idea how I am going to follow Maureen, though. Absolutely no idea at all. Just to echo some of the comments in the chat, Maureen, you are an absolute inspiration. And if I can achieve just half of the things that you've achieved throughout your political life, I shall be an incredibly proud woman. A couple of things really resonated with me with what Maureen said. I think the bit that she said at the end about making time for yourselves is critical. And it's only this last year that I've recognised how important that is. Because I think as an elected representative, you feel that you have to be accessible all of the time for everybody at any time. And there's been a couple of times throughout my political life where I have thought to myself, I'm fast reaching the point of a kind of burnout where you realise you can't do those things. So I think what Maureen said at the end was so vitally important, that as elected members, we do need to make sure that we make time for ourselves, because we are so determined to help others, the people that we serve and represent, that we sometimes neglect ourselves. However, the one thing I will say about this role, and as I talk about my journey, I still pinch myself on a daily basis that I'm in this role, and it's my proudest achievement, and it's one of the best things I've ever done. But I think what I would say is this, starting with Maureen and her early years, really, sometimes it's about the perception of who you are as a councillor. I remember being in a meeting once, and a very angry party member, I'm a Labour Party councillor, a very angry party member had said to me, well, what do you know about working class life? You come from the leafy suburbs of Trafford. And I remember feeling very angry at that, thinking actually when Maureen spoke about living in terraced houses with outside toilets, that was my life too. I'm from the streets of Bateson, where the houses were condemned, and then we were moved across to a brand new council estate in Longside, where we had a front garden and a back garden and an indoor toilet upstairs and downstairs, and everything smelt shiny and new. But yes, my background was very much from, a working class family, and it was my grandma that got me involved in politics. So I think it's important to make sure that when we speak to people, to the residents we serve, to other councillors, to officers, that we can be authentic and real and talk about the journey that we've come from. And when I was first asked would I consider standing for council, I thought, me, why would anybody, how could I possibly be a councillor? And I think it was because I was very much involved in community groups. I was a school governor. I'd be involved in picnics in the park, just getting people together. As my 17-year-old daughter calls me on a daily basis, the world's busiest busybody. And yeah, if that's what the title you get as a councillor, if that's what helping people is being a busybody, then I probably deserve an Oscar for that, absolutely. So I think that I was asked would I consider standing, and I couldn't believe it. On the night when the count happened, I won, but I had no idea what I had let myself in for, no idea at all. And I don't think anything can prepare you. I think it's a bit like parenthood, when people say when you give birth to a child and they go, nobody can prepare you for this. That's absolutely right. Nobody can prepare you. And it's pretty much the same for life as a politician. Nobody can really prepare you. So I had to hit the ground running. And I remember being allocated a mentor, and this mentor spoke to me like I was some kind of giddy puppy, because I was all full of ideas and fizzing about the things I wanted to do and the things I wanted to change. And I wanted to change everything like yesterday. And then I soon found out how local government really churns, and realised that you can't change things yesterday. You have to, work to keep pushing and pushing and pushing. And I think that I started off in a shadow executive role. I was then a committee member, and just to kind of, I've realised that I don't want to pigeonhole myself over this, but actually the skills and life experience I bring to this role. I've worked across the health and social care sector now for 25 years, and I was immediately allocated health scrutiny because that was where my skill set is and was. And the reason I feel so strongly about that too is my background in health and care has been with addiction services. I've managed drug and alcohol teams. I've managed mental health crisis services. I've worked with the probation service and the prison service. And I had a father who was an alcoholic. It was quite a, you know, a sort of troubled childhood, and watching my mum my mum was a really positive role model for me. She works in a jigsaw factory and trundled us 3 kids down the road to my grandma who looked after us. She was that role model who went out to work every single day, and that's where my work ethic comes from. And I have a brother who's been a heroin addict for 40 years. So, you know, all of those services, the reason I became involved in those services was a little bit about, probably I was wanting to fix things for me, but actually, as I've worked across those services, I've realised that I want to change very broken systems for other people that come into contact with services. But I will always recognise how incredibly hard our staff work in those services. And my portfolio area of social care now, what I'm seeing as we're coming out of COVID is a workforce that's absolutely on its knees. And I think, you know, I'll talk about that a little bit more as I go along. But as well as recognising wanting to change things, I think lots of recognition and thank yous have to go to an incredible health and social care workforce that we have working with and for us. So that was my background. I became pigeonholed into health fairly quickly. I was known as quite a difficult councillor, quite a difficult and belligerent councillor. And if being difficult and belligerent means that you ask questions and want to get things done, then again, so be it. Because I was represented to, you know, I was elected to represent and serve people. And that meant I had to ask those difficult questions. Because I think one thing that can happen, and I'm sure there are some officers of the council on this call too, I think we sometimes forget the very reason that we exist, and that's to represent people. And what can happen, we can get very hung up with jargon. I know when I chaired health scrutiny, I used to say to the professionals that would attend my meeting, how many acronyms are you bringing to this meeting this evening? And do I need to give the public a dictionary again? Because and I'm as guilty of it as in local government, health and care, we speak a language all of our own, and we forget that actually we should be trying to relate to the people that we serve. So one of the things that I always, and I remember being on some comms training, and this has stuck with me, jargon is a weed in the garden of language, and that is exactly what it is. And I always tried to make sure I would cut down that jargon. If anybody starts reeling off lots of words, it's like word salad. It's almost like, can you speak in a language that everybody understands, please? So I became health scrutiny chair then, and I have to say, when I became the chair of health scrutiny, I was absolutely beside myself. It was something that I felt I'd really worked for. And then I became the executive member for social care. So I'm now the exec member for social care. And what I am about is being solution focused and trying to change things for the people that we serve. Because again, it's very easy for me and officers to be prescriptive about a service that we think should happen. And we talk about co-production lots. Everybody talks about co-production, but it seems to terrify people. Because every time I look around the table at our health and wellbeing board or at health scrutiny, there's very rarely members of the public there. And I also look at the diversity around the table sometimes. And I think that's incumbent upon all of us as councillors and officers of the council to check sometimes, have we got the right people around the table, or are we talking in an echo chamber? Do you know, we really need to make sure that we have people helping us to shape those services. Some of my other roles are I chair our Learning Disability Board. And again, one of my first meetings in Sale Waterside, I looked around the room and said, well, this isn't exactly a welcoming meeting, is it? We don't have anybody here with a learning disability. We don't have any families or carers. And really, we should shine the light on ourselves and say, are we doing the right thing, or are we ticking a box? If we're talking about collaboration, and collaboration is in the title of what we're talking about here, then if we truly mean that, we need to be engaging better with members of the public and having people at our meetings. So I chair the Age Well Board, and in Trafford, I've just gone out and made sure that we are going to recruit older people across Trafford as part of talking about my generation. So we're going to have older people as roving reporters who are going to be the eyes and ears of people of Trafford, telling us exactly what it's like to age in Trafford. And I also chair our Suicide Prevention Partnership Board. As Gillian mentioned, I chair our Portfolio Holders Network, and that's great working with others across the Northwest to have a conversation about what social care looks like, and haven't we seen the way social care has been impacted upon with COVID, really. So we know we have a way to go. But I think some of the challenges we have really is that when we seek to govern and when we seek to work for the public, we have to sometimes stop seeing those people who come to us and complain as not being complainers. They're trying to tell us something. And whenever we work with the public, so whenever I do public speaking, what I try to do is tell a story, because we have to make the life of people be relatable to others, really. So we can do reports with 100 pages, or we can actually go out there and tell the story of what it's really like for the residents that we serve. So I think what I would leave you with, because I'm aware that we've got quite a lot of work to do and we all want to talk together to talk about the challenges, what works well, what doesn't work so well. My mission really is, I want people to truly understand what local government is and how it changes lives. When I first joined the Labour Party, I thought everything was about the National Party. I thought that was where it all happened. And I've worked on our National Policy Forum with the Shadow Cabinet and, you know, working together to develop health and social care policy. And I've seen how those wheels turn so slowly. So my mission is to get people to truly understand how local government changes lives, because everybody who's on this meeting today will be a leader in some way. We're a leader in the work that we do in our communities, and we do change lives. What we need to do is change lives together, but involve more members of the public to help us, not just become an echo chamber. And I can't talk of as many achievements that Maureen spoke about, really. I know in my heart, I remember once at my, you know, when I think about things, even if I've just got a social care package in place for somebody, even if I've just got a street lamp fixed, even if, you know, the smallest things can make a huge difference to people. And I'm proud of the achievements I've made as a councillor, but I've only been able to do that with true collaboration of others. So thank you for inviting me to speak today, Gillian. But I think now the work is about how we work together to really change things as we come out of COVID. Thank you.
Wonderful. Thank you, Jo. And as you say, how do you follow that? But you absolutely did. And your journey as well, and some of the achievements that you've shared with us is phenomenal. So huge thank you. And again, you know, the comments in the chat, you know, huge kind of powerful stories, and great to kind of hear the journeys that you've been on. We will, and I will hand over to Pam and to Kath in a minute in terms of any kind of key questions for Jo and Maureen. But that, again, maybe if I can just kind of pull out some key themes for me. Again, first and foremost, as colleagues have said, you are both truly kind of inspirational leaders. And sharing your story this morning, I think, has certainly sparked a lot of thought and certainly a lot of passion in others. So huge thank you. I think, again, both of you have shared how you really do kind of listen to your local communities and local people, and be the voice and their voice, whether it's Maureen only having the phone, or through yourself, Jo, being the busybody but being in the right place at the right time to sort things out. That authenticity, I think, really shines through, and certainly the way that you've both shared your personal stories and how your personal starts in life and your family experiences have really shaped how you've taken on your roles and responsibilities in terms of your professional and your political careers. I think the one thing for me, courage, determination is absolutely key for both of you, and the way that you go about being those real kind of determined individuals with and on behalf of your communities shines through. And colleagues that are residents in your patches are saying how proud they are that you represent them, which is absolutely brilliant. Your passion, you know, about people and services and relating the voice of the person. And I think, as you said, again, Maureen, and certainly you said, Joanne, actually what you do in terms of changing things for the better is for the people of, the people that use those facilities, those services. So you're making those change and creating those solutions on behalf of people, with people at the heart, not just to improve the service. And again, I think your themes around respect, avoiding jargon, treating everybody as equals, and recognising the value of working with communities, with staff and with other team members, and enabling true collaboration, and that actually bigger and better things can be achieved if we work together and work collectively as partners. So some really powerful messages there. Huge thank you to both of you for sharing your stories. If I hand over to Pam and to Kathy. Pam, Kathy, are there any particular themes that I've missed, or any particular questions that colleagues have asked that we can bring into the room? Thank you.
Yeah, I will start. I mean, I will say, as a former local government officer, I had so much of that. It was just really brought leadership to life, the really hard decisions, and the fact that you're sort of damned if you do and you're damned if you don't. Really, really amazing, two amazing talks. So the first two questions we've got are around accountability. So I suppose both councillors could answer these because they apply to, any council. So Matt Gaunt says he's interested in knowing whether the scope of challenge and change decisions under the cabinet system is more likely where one party is not so dominant as in Blackburn. And then we have another question from Melissa Surgery about she'd be interested in thoughts on difference in accountability mechanisms we've seen in different parts of public service and our ability to work together.
Thanks, Pam. Maureen or Joe, have you kind of got a view? I guess it's where we've maybe got not just kind of one party, or whether where we've got, I guess, other parties maybe in scrutiny or in other parts of the political system. Thoughts or views in terms of that particular dimension? Yeah,
I would say that, I would say that Labour have been in control most of the time. We did have a period where there was a coalition, and I would say we made a lot better use of scrutiny when we were in coalition. They got us on every meeting and we were asking questions. And we do have a system where any councillor can come to the exec board or a council and raise issues. I would say it's easier with a larger majority and there's less opportunity for change. But that doesn't mean to say there's less opportunity to challenge. And I think that's the important thing. We have a situation at the moment where the opposition party aren't even attending scrutiny meetings because they don't think it's worth the time. I hope they're not on this meeting. But it's there. If you use scrutiny properly, you can challenge properly. Whether you can change opinions, but I think it's important in determining new policy that scrutiny works in a really productive way, challenging not just the executive member, but bringing other partners to the table and helping to develop policy, because in my view, that's what scrutiny should be about, helping to develop policy, not necessarily change the decision when it's made.
Wonderful. It's that kind of proactive, isn't it? Proactive development.
Absolutely.
Using scrutiny as an improvement tool, irrespective of the politics. And I do understand that as a local government officer that can be in there, at times. But actually, as you say, if the focus is around making sure the policy, the programme, and using those mechanisms to get as many thoughts and views and improve and develop, that is in everybody's benefit.
And I would say probably that people's services like children and adults are less open to political differences, rather than people who take part in them actually looking to improve them or to bring issues to the fore, maybe less political than in some other areas of the council.
Super, thanks Maureen. Joe, anything you'd like to add?
I think really what I would say as somebody who is a bit of a scrutiny anorak, really, I really love scrutiny, and I've always said to cross-party politicians really that scrutiny is our friend, and if scrutiny is done well, it's a brilliant tool to really have a look at some of the decisions, but not only decisions that are taken by the executive, but some of the systems that are already in operation across your council. So it's a way of working cross-party, and we all have our political ideology, and we can all say red team says this, blue team says that, but when you get a group of people together, particularly when you're working across health, you tend to find that most people want to do the right thing. What scrutiny should never be is a finger-wagging exercise, because all too often I've heard that, you know, either officers or health colleagues dread coming to scrutiny because they think they're just going to be told off. It should never be that way. It should be that really having honest and frank conversations and not being afraid to ask those very difficult conversations. Another key thing I think from scrutiny is this, that we do task and finish pieces of work, and they can be brilliant for you to pick a particular theme and look very closely. We did one on children and young people's mental health. But what has to be said, if you do a report with recommendations, don't let that report just sit on a shelf and gather dust. Be genuine when you make those recommendations that you are going to try and implement them and work with other organisations and then go back and review them, because otherwise it then just becomes a tick box and a pointless exercise. So use scrutiny and use it well, and you can genuinely drive change.
Really powerful points there, absolutely. Hopefully that answers and gives some kind of insight into that theme, Pam, that you've raised from colleagues. Anything else that we want to pick up before we move into the breakouts? Anything else, colleagues, Pam, Kath, that has been mentioned that we could raise now?
I think a quick one which could help us all in health and local government is about co-production. Alison Lee's raised a point here about how we make it real, and you know, how do you get a public presence in meetings? You know, people are very quick to complain about services not being delivered or not being appropriate, but they're never there to, you know, and could we do more?
Can I respond to that, Gillian?
Please do, Jo, thanks.
So when I became chair of scrutiny, I tried really hard to engage more public to be able to attend, and one of the things I found was that it would always, the public were made to sit over there when I used to invite them to sit around the table. It was, you know, on the rare occasion that we had members of the public attend, I would invite them to sit around the table, and to me that's the right thing to do. It's not about them and us. But I think if we're genuine about co-production, and I have to say this all the time, when it comes to the Health and Wellbeing Board and other constitutional functions across the council, we say we want the public involved, but we don't like it when they tell us what we don't want to hear. So, but also we have to think about where we hold those meetings. If we're continually going to hold those meetings in the town hall, which can come across as a very imposing and officious structure, if we're not going to go out and meet people, then again, we need to look at ourselves and think, why? What is it that we are keeping? Why are we keeping that barrier there? And with our Age Well board, I went around the borough, I took the Age Well board into a school, into community centres. Now, we didn't get the public engagement that we wanted, but that doesn't mean I'm not going to try it again because it didn't work the first time. If it doesn't work the first time, you keep trying again. You don't keep doing the same old thing and say, well, the public don't come to us. It's up to us to go out and actually meet the public as well. And if that has to be in smaller groups and we have to sort of deviate a little from just our traditional meetings, then I think it's up to us to change the way that local government works with the public, really, not expect the public to engage with us in the way that we've always done things.
Wonderful. Thanks, Jo. Maureen, anything you would want to add in terms of co-production?
Yeah, I suppose I would just agree with Jo, and particularly when you have the task and finish groups, it is important that you do go out and that you don't just look at the general public. You look at the target audience that you want to. You look where they're meeting and you go and ask if you can be invited to one of their meetings, to go and listen to their views And I think it's really important. We're just developing currently, and I'm leading on that, a neglect strategy. So we're looking at how we can go through all our partners and ensure that they go through the training. But our next step is to go out to the community centres and work with community groups who will equally see the issues, but what should they do about it? You know, so it's not just asking them, but also saying to them, this is how we can work together. This is if you see a problem, this is what we can do. And this is how you can relate to us. So it has to be a two-way. And Joe's right. If scrutiny make recommendations, it really is important that you go back to them and tell them what you've done about it.
Brilliant. Thank you, colleagues, and some great contributions in the chat as well. Alison, thank you for sharing what's happening in Rossendale in terms of scrutiny in the day. Dynamic kind of exercises there, and again some really good examples. So again, colleagues, if you we can pick those up, and certainly afterwards we can make sure that we can share these widely, so that we can certainly get the sharing and learning across the network and across the Northwest. So huge thank you. Sorry, Joe, did you want to come back in before we go into breakout rooms? No? Okie dokie. Wonderful. Well, thank you, colleagues, for all of your contributions on the chat. Huge thank you to Joe and Maureen for those really powerful contributions. Joe and Maureen will be staying with us for the rest of the session, so they can hear and engage with the contributions that we are now going to ask you to make as we move into the breakout rooms. So colleagues, you'll be by magic moved into a breakout room. There'll be around probably 6 or 7 colleagues with you in each of those breakout rooms. There will be questions that we will put into the breakout rooms that we would like you to consider. So the first areas are for you: when working politically, what have you found difficult? What has worked well? And what would support you to continue to work effectively in the political environment? So we're going to have until 10:50, so just over 20 minutes in your groups. And colleagues, could I ask one colleague from each of the breakout rooms if you would ask to scribe, map down some of the key comments and some of the key issues for each of those questions. And then when we come back, I'll be asking colleagues to put those key themes, those key issues into the chat box so we can gather and share everybody's contributions. So on that basis, colleagues, we will see you in just over 20 minutes. Have fun in your breakout discussions, and we'll look forward to hearing what you've been up to when you come back. Thank you very much. In your breakout groups. What we want to do now is to hear back from you in terms of the key areas. We're going to take each of the areas in separate feedback points, so that we can just make sure we capture everything for the notes going forward. So colleagues, could I ask those that have been the scribe and those who have got the chat box open, if you could just now pop in what were some of the themes or issues that you discussed about what you found difficult in terms of working in a political environment. What are particularly the areas that you found difficult? If we can just see those coming through now. COVID, absolutely. COVID has exacerbated things. Huge thank you for that, Angela. I've got obviously ICS and co-production from Mark, but Mark, was that around difficult, kind of a difficulty? Do you want to just explain that a little bit more, or were they general themes?
Do you want me to talk or type in the chat?
No, talk, Mark, just talk. Yeah, that's fine.
Yeah, so I suppose the thing around the ICS was to do with the fact, so I'm managing director for adult social care in Salford, but we're in the NHS and it's Salford Royal and soon to be the Northern Care Alliance that's responsible for adult social care, because it's all to be transferred and under a Section 75 agreement.
Okay.
And I suppose just thinking about the national developments that are coming now, it was that kind of that challenge around when I first got to Salford. Health and social care was a chasm between the two, and there wasn't that close working relationship between political leaders and those senior officers that were delivering adult social care. So it's something that we had to work on to close that chasm, and some of that would have been around relationships that were there at the time around the creation of the ICO, and people moved on. But for us, it's hard to say anything positive comes out of COVID, but I have to say what COVID did in the Salford system was to bring back to the table everybody that had to be in the same space. So for us, it actually brought me back into the arena with political leadership and got us closer to there and got us having different conversations. So it's something around that how a council is going to land within the new ICS integrated arrangements, and just maybe is there a space to learn from some of the organisations that are further down the integration journey about some of the do's and don'ts. Yeah.
Fantastic, brilliant. Thanks, Mark. Thanks for bringing that to life. And I think, as you say, actually, you know, COVID, Angela's point, exacerbated, as you say, some of those in a positive way, as well as some of the challenges that's presented. Huge thank you, Caroline, for other comments in terms of the areas there that you. I'm just going to bring it back up. Having the right representation in terms of co-production, transparency in decision making, again that authenticity that both Joanne and Maureen talked about, really important. Again, as you say, Angela, with regards to, I guess, the different national and local kind of politics and how we manage that. Alison, huge thanks from group 3. New member, okay, yeah, return, okay, brilliant. The difficulty was the politics, kind of pet projects, old-fashioned, okie dokie, yeah, we recognise those. Huge thank you for sharing group 3. Other difficulties, opening microphone and camera, that's the world of Zoom, absolutely wonderful. Okay, so I think again really helpful in terms of capturing what was been difficult, what's worked well. Again, colleagues, if there's anything else you can share now in the chat in terms of what you captured as to what's worked well in terms of the work that you've been doing in a political environment. Alison, I think that you've kind of popped in there what was good. New members, but worked for a council before retiring, so understood the way things worked. Again, so bringing some of that knowledge and expertise in is really great. And again, I think, you know, hearing from Maureen and Joe, I think it's bringing not just personal stories, but their kind of professional, their professional knowledge and expertise into the roles. Really great. So again, that's complementing Alison's message there. What's working with opportunities to link on a regional level, brilliant. Okay, Caroline's point around cuts, be honest about the reasons, no spin, engage early. Yeah, no, absolutely. And again, I think it is in the co-production kind of collaborative environment, how can we find ways of doing things differently rather than just kind of reducing services as a result of the cuts. Really great, colleagues, huge thank you. And need to resource adequately and take time on service design, yeah, effective co-production, and stop the rounds of 1 and 2 funding. Yeah, so longer term strategic thinking and planning, and working effectively with trade unions. Wonderful, super. Thank you, colleagues. And then the last area we asked you to work through was to think about what support would be helpful for you to continue to work effectively in a political environment. Again, colleagues, if we could ask you now just to pop those in the chat, what support did you talk about that would be really good for us to note to support you going forward? Okay, important to front check things. Feedback from Angela and her group. Okay, yeah, I guess in terms of there's COVID there, support around kind of utilising the engagement that elected members have with their communities around promoting key messages. That was particularly around COVID vaccines. Wonderful. Any other themes around support, colleagues, that you would find helpful? Alison, good to see you. Thank you so much. Thank you for joining us this morning. Mark's point around training and education, both ways. Social work staff, the fact that local authorities are political organisations. Yeah, okay. So again, I guess that understanding of the democratic system and the way that officers and members can work together across the public sector. Really powerful point there, Mark. Brilliant. Huge thank you. Well done. And again, training and I guess exposure to people with lived experiences. Yeah, that authenticity again. Hugely important point, Ruth. Thank you. Thank you so much. So again, colleagues, some really key points there, and I think really do dovetail and connect with some of the key messages that we heard about in the first session, which is absolutely brilliant. Thank you very much indeed. What we would like to invite you now is to enter back into breakout rooms, because again, I think it's really important for us to share and learn across colleagues that are on the call this morning. And what we wanted you to think about is building on the great work and the great conversations that you're doing and having this morning, is to really think about looking ahead, looking forward. You know, as we've said earlier, we're all leaders in one way, shape or form, you know, in the public sector and in this space. And obviously what we are very much kind of doing now is moving into, I guess, a hybrid, a new way of working, and working much more in a connected and a collaborative way. But in terms of our contribution to that, we'd like colleagues to think about how in your leadership role will you ensure that together we fulfill our collective duty to collaborate. What are some of the things that we're doing? What are some of the things that we could do that would enable us to do that? Again, as a collaborative with yourselves, we thought it'd be really interesting for us to think about, you know, as a public sector, what could be the key elements of our collaborative pledge? So if we were really serious, which we are, about going forward, working together and getting kind of the greater bang for our bucks and bigger and better by working together, what would be the things that we would pledge to do together? So we're going to go into breakout rooms again until just before 11:30. And if colleagues, again, if you could have a scribe, huge thank you to colleagues that have captured the conversations from the last breakout. If again, we could have somebody that would capture the feedback from those two questions. And as we've just done, we'll cover the first one, pull out the key themes, and then we'll cover the second one. And the questions will be on screen for you, so you can see them. But thank you, as always, colleagues, for your continued engagement and participation. Effie, again, will do her magic and will put you into breakout rooms, and we'll see you in just short of half an hour. Thank you. See you in a bit.
Yeah, I'm sorry about that. There's nothing I can do about the recording in progress message.
Don't you worry, Effie. We're used to it now. Good to see everybody coming back through. Thank you for staying with us. And hopefully you've had great conversations in your breakout groups. Huge thank you, colleagues. Great to see you all, and thanks for keeping your cameras on as well. Lovely to see you. I appreciate some colleagues have had to jump off for other commitments, but hopefully we have got scribes from each of the breakout groups, and that you've had a good discussion building on all the great work that we've done so far this morning. So it would be super if we could just take the first question and the discussion that you've had in your breakout groups, where we ask you to reflect on, in your leadership role, how will you ensure that together we fulfil our duty to collaborate? Again, colleagues, really kind of welcome if you wouldn't mind now popping into the chat what some of the key themes, the key issues, some of the key aspects of your discussion were with regards to that particular duty to collaborate, and what can we do together. Brilliant. Thanks, Angela. Breaking down organisational barriers. Super. Yeah, brilliant. And I know today, obviously, we've got a cross section of colleagues from across the public sector. We have in the past as well worked with colleagues at the clinical leadership forum, where again we've met with colleagues in health to talk about kind of working relationships. But again, maybe we can think together about how we could maybe do that more. You know, what could we do individually and collectively to actually look at breaking down those barriers. So any kind of thoughts on views on that would be great. Again, Angela, thank you. In terms of sharing resources and funding, yeah, really great. And again, I guess work that we're doing together in integrated care systems is aiming towards some of that as well. So that's something, again, we can think about and pick up together. Caroline, thank you, from group 4. When it all gets difficult, change tack or say sorry, get help from sensible legals over possible liability, stick with principles of honesty. Again, I think, you know, when we are kind of working together, collaborating, and again, I think key message from both Maureen and from Joe, that kind of spirit of honesty and really kind of having that, you know, honest and trusting conversations with colleagues, really important. And again, a theme from Christina and her group, creating trust and trust between residents. Again, I think as elected members, and certainly the work that we do as officers, building that trust and those relationships. I think, you know, it's a people thing, isn't it? And I think that's been a message from all contributions this morning, actually treating people with respect, building the trust and listening and acting accordingly. Really powerful messages. And apologising things go wrong, absolutely. Yeah, we don't get everything right all of the time. And again, linked to, I think, that theme of honesty, transparency. People will respect us, I think, if they feel that we are authentic and we are being honest with them. Less emails, more conversation, and banning kind of management speak. It's not my job. Brilliant. Yeah. And is it Elvis, Maureen? We were just talking about Elvis. A little less conversation, a little more action. Yeah, absolutely. Let's bring that into the room. I think absolutely, you know, and I know a number of organisations now, in terms of kind of moving into hybrid working, they are encouraging colleagues to pick up the phone, you know, where we can have face-to-face and it's safe to do so, but actually have a much more kind of human element to the work that we do. And as you say, you know, Maureen's point, it's not can't or won't, it's kind of, well, you know, there's you know, varying versions of yes. Let's find a way to achieve that. Brilliant. And fleet of foot decision making. Yeah, we do like a good meeting and a good governance structure, don't we, in the public sector? But actually, how we can find ways to kind of make decisions and move things forward as pacey as possible, and to show again that responsiveness to our colleagues and our residents and communities, really important. Fantastic, colleagues. Wow, well done. Brilliant discussions that you've been having in your groups with regards to fulfilling our duty to collaborate, and we'll certainly capture those key messages and make sure they're in the notes going forward. If we haven't got anything else on question 1, and again, really powerful feedback. If we can jump on to the second question that we asked you to consider, which was, as a North West public sector, what would be the key elements of our collaboration pledge? And we've possibly got some of those already kind of coming through. Again, I think, you know, creating trust, you know, authenticity, you know, being honest and open, working collaboratively, you know, not my job. There's some great kind of messages there already. But anything else, colleagues, if I can ask you to pop in the chat, what were some of the other, if there were additional key elements around what we should think about in terms of our North West collaboration pledge? I think have we captured it? Oh no, really sorry, I've got to leave. Okay, no problem, Janet. Thank you. Fantastic. Taking the time needed to engage. Again, really important point there, Ruth. You know, again, that can't be rushed, and sometimes, you know, we could be seen as it being tokenistic if we don't do that from a genuine place. You know, if we are talking about engaging either with others, you know, or with our residents, or with our, you know, with our wider communities, actually, you know, taking the time and building it in throughout the process, and it's a continuous conversation and a continuous two-way communication. Really, really important. Super. And Caroline, thank you. Your points, help community involvement through sharing or dedicating funding. Yeah, absolutely. Another kind of key theme from before. Understand and align our risk appetites, yeah, or change them. Again, I think that's a really, really important point, especially I think in terms of our different cultures in different parts of the public sector. Again, through my experience working in local government, and other sectors, actually the democratic infrastructure is different, you know, to board structures or non-exec arrangements, and that will impact, I guess, on risk and levels of risk and speed of decision making as well. So having that understanding or getting some collective ground rules around that, really, really important point. Get someone to pull together best practice for us so we can have a range of possibilities in our decision making and use the NHS principles of participation. Brilliant, absolutely fantastic. Well done to that group, really powerful feedback there. And Joe, huge thanks, supporting the Nolan principles. Yeah, a public life, a really, really good suggestion. An example such as kind of voluntary register of interest for public decision makers that are not compelled to declare. Fantastic, absolutely fantastic. And Kathy, wow, we're keeping them coming. Honesty and recognising the limits of our abilities. Absolutely. We're only as good as the team around us, and yeah, we can all play our part. Really, really positive message. And ensuring we collaborate with organisations to fill the gaps. Yeah, not just those who we want to work with because it suits us. Brilliant, brilliant point. Absolutely. And I think, again, going back to some of the comments from this morning, we work together and we design things because the core purpose is around people and communities, not because it suits the service or it suits us as individuals or our organisations. So a really, really powerful message there and a great way to continue that theme. Wow, colleagues, absolutely brilliant. Huge thank you for all of your great work and all of your great conversations this morning. We will certainly make sure that we capture all of those in the note that we send round. But Maureen, is there anything in terms of the feedback that we've got there, any reflections from yourself that you'd like to share?
Well, I think it's been really interesting, and I think the important thing is that we've had people on from a whole range of different services, and I think that collaboration, working together, you know, and I think that's something the North West employers might want to think about, you know, rather than being siloed in you know, I come to children, so, you know, having more people together so you can discuss these sort of issues. I can't think of, I can't disagree with any of the comments made there, but I think the mixed meetings might engage. One of the things I would say is that when taking the time needed to engage, I think that's really important, but never engage as a token, a tick box exercise. And I think, you know, bring back whatever discussion you've had with people. One of the questions I asked, and it's a very simple question, so often I ask when people present something is, so what? So what difference is this going to make to the organisation, the people, if we do this? And if you can't answer that, then why are we doing it? And I think it's really important, no matter what organisation you work for, is to ask, why are we doing this? Obviously, there's costs, there's everything. And I think that we do fill gaps, but we need to know where those gaps are. On the last point there, what we do know is what we do know. What we don't know is what we don't know. And I think that's the important thing. And it is those black holes that sometimes people fall into. I always come back to children, people with disabilities, and that when they move over with that transition period from different, you know, and it can be a transition from anything. It can be if you've suddenly had an accident at work and you become disabled, it's that transition, not knowing what there is there. So making it easy for people to get through your system, no matter what your system is. But as far as I'm concerned, it's been a great morning and I've enjoyed it.
Wonderful. Thank you, Maureen. Fantastic. And again, I think, you know, really powerful, as you say, you know, constantly say, so what, you know, and as we say as well, you know, start with the why. You know, again, there's a great book, Start with the Why, but that, again, the whys and the whats, you know, I think simple words, but really powerful if we use them constantly. In terms of the work that we do and the policies and the services that we're designing. Huge thank you, Maureen. I do appreciate. I will come back and formally thank you. We've just got a few more aspects to finish before we do, but thank you for those reflections. And again, colleagues, I think as Maureen said, a hugely invaluable couple of hours that we've spent together. And we would welcome kind of your feedback. I'll hand over to my colleague Alana in a minute, but I guess what we started today's discussion and conversation around was to think about the political leadership and learning how democratic and participatory approaches can make a difference across public services. And we were aiming to hear, obviously, from political leaders in terms of their craft, the skills they use, the challenges. We've certainly kind of heard from Maureen and Joe about some of the challenges and the way that their tenacious and focused approach has driven them and the great work that they've done forward. And hopefully you'll feel that we've had an opportunity again as a community to come together, and as Maureen says, from different sectors to bring our collective knowledge and expertise to think through together how we work in a political environment and how we can kind of strengthen our ways to work collaboratively now and going forward. And I think, you know, through the aspects that you've listed in terms of a pledge that we can work together, not just, I guess, from today, but as a collaborative, and all of our kind of 6 partners with yourselves driving the masterclass programme forward. I think there's some fantastic principles there that we can certainly adopt and drive forward. So we would like just to ask you a couple of questions just to gauge how the session has been for you. So I will hand over to Alana. and ask her to manage the Mentimeter session, if you wouldn't mind. Thanks, Alana.
No problem. Can everybody just give me a thumbs up if you can see my screen? Fabulous. So this is literally just a few questions just to help us gauge how you're feeling after today's session, how relevant the content was, if there's anything that we can improve going forward. So you can use a tablet, your mobile phone, or you can open a tab up on your laptop in your browser. And if you just go to, and apologies, I think my screen share is blocking the code, so bear with me. Let me just...
We can still see it, Alana.
Can you see it at the top?
Yeah.
So I can't see it, unfortunately. So if you go to www.menti.com and then you pop in that code at the top of your screen, it should take you to the introductory slide that you can see on the screen. And then if you could just give me a thumbs up when you're there, and I can start presenting some of the questions. We just wanted to do it in this way as well, because you'll be able to see, as you're responding, with me sharing my screen, you'll be able to see everyone else's comments as well. So we can start to see what's coming through. So I'm starting to get a few thumbs up. Drop me a message, or one of the team if you're struggling, or raise your hand. I can see some love hearts coming through there. So I'm just going to take it on to the first question around what's been the most useful element of the session. And this can literally be anything. We've kind of left it as an open question for you. So is it the fact that we've got people from other sectors, other organisations? Have the breakout sessions been useful? Has it been good to hear from Maureen and Jo? So yeah, let us know what's been the most useful element for you. Fabulous, and starting to come through now. Breakout discussions, networking, similar challenges, yeah. Real examples, fabulous. Communication. Speakers. I'll just give it another minute or two. This will still be open as well after the session, so I think it'll be open for another week. So if you wanted to go back in and give your thoughts afterwards, that's absolutely fine. But it's just to get a feel of how we are right after the session. So I'll move it on then. Thanks for everyone that's responded. So the next question: is there anything we can improve upon? And this is anonymous, so don't worry. But yeah, anything in terms of the organisation, any information that you received before the session, or during? Fabulous. See people like they're typing away, so I'll just give it another minute and then we'll move on. Fabulous. Oh, we've got a couple more coming through. Brilliant. So there's quite a lot in there around having more speakers, hearing more from the experts. Brilliant, thank you. And I will just move us on, but like I say, it will be open after the session. Oh, we've still got more coming through. Thank you. And then just finally, have you got any recommendations for any future events? So any topics that you'd like to see us discuss in the future? We are around the time where we're planning next year's programme. So for this year, 21-22, we have got the programme of events confirmed. And we have a brochure we can share with you, but just thinking about if there's anything next year that you might like to see on that programme, whether you'd like us to do this event again, or any other topic. And I'll just give it one more minute, just in case anybody has any final comments before I hand back over to Gillian.
I wonder if that's aligning organisational culture. Just been reading that's what it can sometimes do, that, yeah, can't it? When it splits a sentence up, changes the meaning.
Fabulous. So I would like to say I'll pop the link to this in the chat box, and then if you want to have a little think about it afterwards and let us know, it will be open for another week. Equally, if you just want to send us any thoughts or comments or pop them in the chat box, that's absolutely fine as well. So I'll stop sharing for now and I will hand back to you, Gillian.
Brilliant. Thank you, Alana, and thank you, colleagues, for your honest feedback. As I say, we really do take that on board to make sure that the design and the focus of these events really do hit the bill and make sure that you find them useful and valuable going forward. So thank you for your contribution. So I think at this stage now, I can offer my sincere thanks to Maureen for an extremely inspirational and enlightening contribution, as everybody have said, and we'll be canvassing and campaigning, Maureen, to get you next to Barbara Castle in a statue in the centre of Blackburn. But huge thank you, absolutely fantastic contribution this morning. Joanne unfortunately has had to leave us, but again, huge thank you to Joanne as well, and huge thanks to everybody who, as part of the collaborative team, to making today the success that it is and everything working so seamlessly. Huge thank you, colleagues, and again to everybody that's participated. You always come ready to engage, ready to participate, and that makes the masterclasses the success that they are. So huge thank you to everybody for staying on the line, and everybody that has been with us throughout the morning, and some that may have had to dip, but huge thank you. You make it the success that it is. We will look forward to seeing you at our next masterclass session. We have popped it in the chat, but for ease, the next session is on Thursday, the 14th of October. It's with our good friend and colleague, Perry Timms, and the focus is on the Energized Workplace. So again, if we need any more energy, Perry will work us through that. But I think today we've certainly had a lot of energy, a lot of insight, and a fantastic conversation. So on that note, colleagues, can I wish you a brilliant afternoon? Huge thank you again, and look forward to seeing you next time. Take care.